On this episode, we're tackling one of the biggest myths in the rehab world. Physical therapy is boring and not built for athletes. If you've ever walked into a clinic and felt like the exercises were designed for your grandma, not a competitive baseball player, you're not alone. I hear it all the time. And to be honest, you're probably right. But that doesn't mean rehab is boring. It just means you went to the wrong place because real physical therapy is built for athletes. It's training in the presence of injury. It's strength and performance modified for your current capacity. And if you're not sweating, progressing, or feeling like you're preparing for your sport, that's not rehab. That's a waiting room with weights. Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being mound ready. So athletes tell me all the time, I went to PT after my injury, but it didn't feel like I was doing anything that really helped me throw harder, move better, or get back in shape. And they're honestly right to feel that way. A lot of the traditional PT clinics are volume based. I mean, they're pushed to really, really increase the amount of people that they're seeing per hour to increase the amount of money that they're making. They're designed to see three, even sometimes like four people all at once. They give everyone the same freaking banded exercises and say, see you in a week or see you next time. And for non-athletes, I mean, maybe that works. Maybe people get a little bit better with low intent exercises and just slowly progressing over time. But if you're a pitcher trying to get back on the mound, that's not going to work, right? If you're trying to throw at 90 plus miles per hour, if you're trying to pass a return to play or return to performance exam, then you're going to need a different approach. And that's where the real rehab should really look like this. This is where we flipped our script. Rehab is absolutely still training. You don't stop being an athlete just because you're hurt, right? I mean, you adjust the stimulus, you lower the intensity, you modify the plan. It's just based on the type of injury or the type of pain that you have. But the mindset is still the exact same. It's like, here's what rehab should actually look like whenever you're training in the presence of an injury. Strength testing with real numbers is number one. You got to test things like grip strength. You got to use a handheld dynamometer. You got to look at torque to body weight ratios. You got to include your plyometric progressions when those strength metrics are hit. And then you got to build eccentric control and humeral head dynamic control before you start to throw again. You got to go through like force deceleration or absorption. You got to go through force acceleration and then repetitive plyometrics. It's got to be in that order. It's got to stay consistent. And of course, conditioning that is like going to show you the demands of your sport and it looks very similar. It's got to blend with your strength and conditioning program. Those aren't two separate things. Like your PT rehab needs to go in line with your actual training. If your PT is not asking you about your actual training outside of what they're doing in the clinic, then you need to tell them because they need to know when they're overtraining you or they're having you do some of the same exercises that you're also doing with your strength and conditioning coach. Your physical therapy plan, it should absolutely feel like work. And it should give you confidence that you're building a better version of yourself, something that looks very similar to what you're going to have to do. You shouldn't just feel like you're healing, right? That's like the first phase of rehab is facilitate the healing. And so once you're out of that, like it's not as painful anymore. I feel like I can actually throw, then the exercises should start to mimic those things. It's all dependent on what does your strength look like? How good is your dynamic control? If those things are looking good and those numbers are getting you to an area where you're ready to start plyometrics, then we should really be starting plyometrics because that's the get you ready to throw phase. So if your PT is just kind of guessing at what exercises are next, then yeah, I mean, that's not the right thing that they need to be doing. So this leads us into the next topic of like, why does generic rehab fail athletes? Well, let's just call it like it is. A lot of physical therapy is too cautious with athletes. They treat them like they're fragile. They're scared to actually load the patient with exercises that are load based, or they just don't know how to actually load the patient. And they're like, they think if you're not in pain, then you're like good to go. And that's just so far from the truth. The actual truth is like, you're not fragile. You're just undertrained at that point with them. And if your current rehab doesn't challenge your movements or introduce new movements that mimic baseball, your strength needs to continue to get better. Your coordination, not just without load, but also under load, has to continue to improve. If you're not doing those things, then you're just kind of waiting to break again once the volume starts to ramp back up, right? Like you went to physical therapy for a reason. What you were doing previous to that moment when you got injured is kind of what got you there. And so if we don't change something and we just wait for you to start feeling better, then you're probably going to end up back there. That's kind of the issue. Baseball in itself is not just a low load sport. Pitching is like one of the most violent movements in all of sports. It's so incredibly fast paced, and the degrees per second of rotation at like 7,500 degrees per second. That's like taking your arm and spinning it around in one spot 19 times. That is an insane amount of torque on the shoulder and the elbow. And elite level coordination is required of your entire body to make sure that you're able to control that move. Like you can't fix that with banded rows and 3-pound dumbbells for sideline external rotation. We use those early on, and sure, like we're going to load you up with little dumbbells initially and slowly build it up so you're able to tolerate it and it's not painful. But eventually, like that's not where it ends. That's kind of just the early phases or the transitional phase between you're hurt and you're not in pain anymore. Those exercises have to really start to get loaded with like 5 pounds, 10 pounds, even like 15 pounds for some of those exercises, really trying to strengthen the muscles because the capacity of the muscles is what's going to improve your dynamic humeral head control. And that's also what's going to allow you to tolerate the throwing whenever you get there. So instead of doing all of these things that we're talking about that are not good in traditional PT, these are the things that we're going to focus on and do instead. First, we test. If we're not tracking strength, mobility, symmetry, we're guessing. And that's not what we want to do. We want to know exactly what's next and what are the things that are missing in this athlete's plan that we need to start working towards. It's like we call them buckets of need. There's different buckets for every single thing that we're aiming for this person based on the needs analysis that we created for this person in this sport. And then for the buckets that are less filled, we're going to start to fill them up so that they're all ready to go whenever it's time for the patient to go. We build these systems. We have core, we have legs, we got scap, we got rotator cuff and grip. It's not just isolated drills. There needs to be compound movements. We're going to prepare your body for velocity, endurance, volume. We have data-led checkpoints. It's like, okay, when you reach this section, you're going to have readiness for plyometrics. When you reach this criteria, now it's time to get ready to throw, or now it's time to start throwing. When you get to the next phase, okay, now it's time for you to get integrated back into the sport. We got to make sure your arm is ready before the mount and your mind is confident when you get there. Of course, sometimes we lift, sometimes we sprint, sometimes we throw med balls like we're trying to put a dent in the freaking wall. But rehab shouldn't look that different from training. It should feel like training with the guardrails on. You're building your power back with complete intention, and it's structured in a way that it makes sense to you why you're doing what you're doing. If you don't know what the next goal is, then either we need to ask or we need to make sure that you get in line with what's going on in that PT's mind. So that way, y'all are both on the same page. We're not just waiting for the pain to go away. We're getting you ready to get back on the mound. So if you've ever thought physical therapy was boring, you're probably right. But that doesn't mean PT is broken or PT fails you. It means your PT wasn't built for you. You deserve a program that pushes you, tracks your progress, and gets you back to doing what you love at the highest level. If you're coming off of an injury or you just want to make sure your body is right and you're ready for the demands of the season, you can comment on this video. You can comment on the podcast. You just got to get in touch with me somehow, and I can make sure that you're doing the right things. Let's just make sure your rehab actually feels like training, because that is ultimately how we get you mound ready.